New numbers out today show nearly 1.5 million Americans filed for unemployment last week. So what does that number mean? Well, it is higher than we were expecting. It means people are still losing their jobs because of this pandemic. Weekly jobless claims had never hit that million mark before the end of March, and now they just can't seem to fall below it. NBC News senior business correspondent Stephanie Ruhle is joining me now. And Steph, that weekly number disappointing, but I know you've been watching continuing unemployment claims. That's the total number of people getting paid every week, not just new claims. What are you seeing there?
Here's what's worrisome for us. Remember, there was this idea that we artificially shut down our economy to face this pandemic, but then we were going to turn it right back on. Well, turning the economy back on isn't so easy. Think about reopenings. You've got hotspots like in Texas where you're seeing businesses close again. Apple has closed some of their stores. You've got Disney with many of their employees now signing a petition that they don't feel comfortable going back to work. So the fact that we're continuing to see more and more people go on unemployment every week means that booming snapback you thought we were going to get is going to take quite a bit longer.
Steph, you've also been taking a look at pandemic unemployment assistance claims. How rather are those different from typical claims? What are you seeing there?
Okay, this is hugely important because when the CARES Act was signed, they expanded unemployment benefits. Chuck Schumer called it unemployment on steroids, where you had people that were part of the gig economy, people who are self-employed, now able to get those benefits. They gave more money for a longer period of time, that extra $600. Now, here's the issue. That runs out next month. And I can promise you, the almost 50 million people who are on unemployment, they're not going to be all getting back to work in the next month. So some say, well, this program isn't perfect, but it's a robust program while we have so many people that aren't working and so many businesses still shut down. So there's more and more pressure on both sides of the aisle for Congress to get back to the table and figure out another stimulus package, because when the unemployment benefit runs out, when the PPP money starts to dwindle, you're going to have a lot of people and a lot of businesses in serious need. And it's not just about the individual. Remember, it's consumer spending that drives our economy. And if you've got millions and millions of people with no money to spend, that's going to hurt all levels of business.
Steph, let's talk more about that extra $600 a week that people are getting from the CARES Act. As you said, that is set to run out at the end of July 1st. USA Today reporting, though, that may not be the case. Do we know what's going on there?
Well, they may extend it. But, you know, there are arguments out there that because this unemployment benefit is so robust, there are certain businesses, specifically in certain regions of the country, that have struggled to hire people back because they're getting more financial security because of that benefit. And it's caused some more Republican lawmakers to say, well, people just don't want to go back to work because the unemployment's so good. That is a completely overused statement that, for the most part, isn't true. Remember, we still don't have childcare in a big way. We still don't have schools open. So it's easy to say people are choosing to sit on unemployment. It's a very complicated situation, and we still don't have federal guidelines on safety. And go to your Main Street, wherever you are, and ask those small businesses how much information they're getting from the government. And each one is going to tell you it's really confusing.
Steph, big picture, when we look at today's numbers, when we look at the situation we're in, what does this tell us about where we are as an economy and how far we have to go?
Allison, it tells us there's a long road back. Now, it's not that there are no jobs out there. There are. The demand has shifted. We've talked about this before. We know that bigger businesses, specifically big box stores, have been hiring. You can look at certain industries and they are hiring. Remember, demand shifted. So for those people that are out of work, let's say they work in retail and they're going, how am I possibly going to get a job again? I just got laid off at Macy's and the Gap isn't hiring. The key for people who aren't working is to think about what is your skill set? Not what industry were you in and where can that skill set work. People who work in customer service, people who are good problem solvers, there are jobs for a lot of businesses if you've got that skill set. But you got to think creatively. And also, if you're on unemployment, which, as I said, we have almost 50 million people who are, this is a time, if you have the time, to take advantage of free training. Pick your industry. There are online free training courses now more than we've ever seen before. So if you have this time, try to use it wisely, because we're in for a really difficult road, and there's not going to be a snapback or an immediate answer. You got to get creative and constructive.
Steph Ruhle, thanks so much.
Thank you.
Arkansas seeing a spike in coronavirus cases. Health officials there reporting nearly 700 new infections in just the last 24 hours. NBC News correspondent Ellison Barber joining me now from outside a Tyson food plant in Springdale, Arkansas. And Ellison, there is an outbreak at that plant. Tell us about it. How bad is it? And what are you hearing from people who work there?
Yeah, so, I mean, across the state, coronavirus cases have been on the rise. Hospitalizations statewide are the highest they have been in this state. They hit a record this week in terms of hospitalizations. In Northwest Arkansas, where we are, they're seeing a pretty significant uptick in terms of cases. And the governor, as well as other officials, have said that they believe part of this overall uptick here is tied to the numerous poultry processing plants in this area. There are three major companies that operate and have processing plants here. Tyson Foods is one of them. And they say that they have tested employees now at 10 of their Northwest Arkansas facilities, and out of nearly 4,000 employees, 13% tested positive for COVID-19, and 95% of those cases, those positive cases, the individuals were asymptomatic. At this plant behind me, they said they had over 200 people test positive. Tyson says that they have implemented safety measures at all of their plants. They have plastic dividers up between workers on the production processing lines. They say that they are giving everyone masks. They're required to wear them, even giving some people plastic face shields if they're in a more open area. They also say they've now added people on their floor that they call social distancing monitors to make sure that workers are keeping space between each other as they are working. But workers that we have spoken to who work inside these processing plants, the Tyson food processing plants in Northwest Arkansas, say what Tyson is doing is simply not enough. We spoke to one woman. We agreed to not show her face because she said she was afraid that by speaking out to us, she would lose her job. She works at a Tyson factory in this area and actually tested positive for COVID-19 herself. One of her family members who works at a different plant not run by Tyson, another one in this area, they tested positive for COVID-19 as well. And within 10 days of finding out they had it, they passed away and died. Here's some of what she told us.
Are you afraid that by talking to us that you could lose your job?
Sí.
Why is it so important for you to sit here and talk to us, even if you're worried about losing your job?
Porque la muerte de mi pariente no es nada fácil.
Because the death of my relative hasn't been easy at all. Well, I lost that family member, but it hurt me that these companies know that it's us Hispanics working en masse at these poultry processing plants, and it's where we earn our living every day. But it's also where we risk losing our lives in order to have an income to sustain our households.
That woman told us her family member had a surgery a few weeks before. They had run out of their sick days, their vacation time off, and felt like they had to choose either go back to work while they knew that there was some risk just because of the nature of COVID-19 and the way that we're all having to live right now. And they felt like they needed to go back because if they didn't go back, they would lose their job. And so they didn't really have a choice. The workers that we have spoken to, that woman as well as another Tyson food employee here, they say that they feel like Tyson, given the numbers that they have found through their own testing and how many of the cases were asymptomatic, that they should shut down their plants in this area for at least 2 weeks, keep everyone away from each other, and do sort of some big extra deep cleaning process. Allison?
Ellison, what are you hearing from state officials about these employee calls to close down the plants? Is there a chance that that could happen if they don't get things on track here?
So yesterday I asked the governor exactly that. I asked him if he felt like it was safe to keep these processing plants open, given the numbers that we're seeing right now. And again, given how many of the cases, how many of the people, according to Tyson, were asymptomatic, he told me that he did not think that they needed to shut down and that it is safe. Listen here.
The answer is yes, they should remain open. They're a vital part of our food chain, not just in Arkansas, but across our nation. And they have gone to very extraordinary lengths to do testing, to do their own tracing as needed, and to put their facilities in compliance and even above that with the public health requirements.
So of the 3 major meat processing companies with plants in Northwest Arkansas, as far as we know, Tyson Foods is the only company to do on-site large-scale testing. But the workers we spoke to say this large-scale testing where they found all of these numbers that we now have, that it was the first time that they were tested at work. These other companies, they say if an employee wants to go get a COVID test on their own, that they'll waive and cover some of the out-of-pocket cost and possibly even some of the transportation cost associated with going to get the test. But the workers that we've spoken to, they said they feel like the company itself should be doing these types of large-scale COVID tests on the site when they walk in, you know, at least once or every other week. Allison?
Allison, we see you there wearing a mask. Arkansas rejected calls to mandate face masks, but some individual towns and cities are taking their own measures to keep people safe. What kinds of things are they doing?
Yeah, so the city of Fayetteville decided to pass their own ordinance mandating masks. And actually, one thing that they've done is not only are they telling people that you must wear a mask if you're going to go into businesses, if you're going to go out in public, but they also set aside, I think it was about $20,000 so the government could pay for around 37,000 disposable masks and actually provide those to businesses. They say that businesses can't just tell people you have to come in with the mask, that they actually have to provide them to customers as well so that everyone is wearing a mask if they enter their establishment. We've been in Fayetteville the last couple of weeks, and almost every business we've been into, I mean, certainly everyone is wearing masks, but we're also seeing boxes, gloves, and hand sanitizers, boxes of masks sent out so that customers can get one free of charge when they walk into the building. Allison.
All right. Allison Barber in Arkansas, thank you so much. The governor of Texas pausing the state's reopening plan and ordering some hospitals to cancel elective surgeries to free up space for coronavirus patients. NBC News correspondent Sam Brock spoke with a doctor in Houston about the spike in cases.
Did this situation escalate in a matter of weeks in Houston?
You're absolutely right. Really, in a matter of a few weeks with the opening of society, we started to see the numbers rise. First, there was just a trickle, and then over the last 14 days, things have shot up exponentially. We think that there's a number of different factors which have caused this. As we've reopened society, I think a lot of our community felt that we had turned the page on coronavirus and that we had really maybe moved past this. Unfortunately, that really wasn't the case. Now people are out and about, people are at restaurants, they're at different malls, shopping venues. If you go to the beach, there's many pictures where it's quite crowded. And occasionally we did notice a lot of folks not wearing masks, folks not really socially distancing. And one of the more worrisome trends is also congregating in some larger groups. I think when those things happen, it's only inevitable that people will get affected.
How is it possible at a place like Houston, which has, you said it, the largest medical center in the world? How are you guys running out of hospital beds?
You know, I think for us, we're taking a very measured and cautious approach. We have a lot of great lessons that we've learned, unfortunately, throughout the course of this pandemic and over the past 12 or 16 weeks. One of our stated missions is to make sure that we remain Houston Methodist being a very safe facility and a facility where we can treat patients 24/7 through our EDs and within our hospital system. We will also make sure that we can treat both COVID patients and non-COVID patients. So we've taken steps to increase our capacity, both on the floors in the ICUs. We've also taken steps to make patients kind of process through our ER in a little bit of a faster manner or faster fashion.
Is this the worst health crisis you've seen in your time?
I think by far, this has also been a concerning healthcare crisis because it's been so long. I mean, we started learning about this in late February, early March. Here we are in the middle of June, and we're kind of really in a second wave. What's troubling to us as physicians and also members of the community is if this is what happens when you reopen, you know, our concern is this going to happen in other areas around America?
COVID-19 cases in the U.S. might be 10 times higher than what's been reported. That's according to the CDC, based on blood samples across the country. For every confirmed case, they have found 10 more people with antibodies. Emergency physician Dr. Mario Ramirez joins me now. And Dr. Ramirez, that update from the CDC would put the true number of cases in the country over 20 million. What do those numbers tell us about where we are with this pandemic in the U.S.?
Well, it's certainly possible that the counts could be that high. You know, I think what we are looking at now is the consequence of the testing fiasco that we had when this first kicked off. That's why so many people were stressing how important it was that we had a better testing regime, because now, 6 months later, we really have no good idea for how widespread this is.
Texas, Florida, Arizona, they are all facing a shortage of ICU beds. What do these states need to do to keep hospitalizations from getting worse? And are there lessons for them to learn from states like New York and New Jersey that have managed to get their ICUs under control after being absolutely inundated?
Absolutely. I think one of the most important things that we can do in this situation is move from a position where we're trying to react to the virus to a situation where we're proactively planning for much greater spread. If I was the governor in one of those states, what I would recommend is that they look to the lessons we can take from New York and New Jersey and do a couple of things. The first thing they need to do is make sure that they have a process for emergency interstate credentialing of healthcare providers. We tried to surge nurses and doctors into New York and New Jersey, and that was a big problem. The most important thing those folks can do is make sure that they have a pipeline to do that, because we're going to see these cases continue to go up over the next few weeks. The second thing they need to do is to make sure that their supply lines are intact for medicines and PPE, because the need for those materials is about to skyrocket dramatically in all three of those states. And then the third thing they need to do is double check their logistics supply lines, because we may be in a scenario where we're not just trying to surge material into one part of the country, the Northeast, like we did a few months ago. We may be in a position where we're trying to surge these materials into the Southwest, into Texas, and into Florida at the same time. And we need to be planning for that now.
Dr. Ramirez, we have been hearing this week that the death rate is lagging behind this surge in cases that we're seeing. What does that really mean?
So it's a great question. This is why, I think so many of us look at these curves in these states with such concern. So with this disease, the average time to hospitalization is about 7 to 10 days. So that means from the time that somebody gets sick and starts to show symptoms, they don't get hospitalized for a week after that. And then of that group, a certain amount are going to have to require ICU hospitalization. That time point doesn't happen until day 10 to 14. And then subsequently from day 14 to 21 is typically where we start to see the first rise in fatalities. So what's concerning about this, and what people need to understand, is that all of these case counts that have been rising in those states are unfortunately about to come due in the next 10 to 14 days. This is when the fatality numbers are really going to start to climb.
Dr. Ramirez, thank you so much for being with us. Appreciate it.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.